First off, I want to thank each and every one of you for joining us this morning. We're really excited about bringing this conversation to the community, and it's something that Kaiser Permanente, the Seniors Council, and the Santa Cruz Warriors have been talking about for quite some time. And we initially were hoping to do these in person when we started these conversations, planning conversations back at the beginning of the year. And then, of course, circumstances have changed, and here we are. But we're really glad to be here today, coming to you all virtually. I want to start off by saying that this topic of social isolation, as many of you know, here in Santa Cruz County, has been really at the forefront here in the community. With last year, the Museum of Art and History and their fantastic exhibit that they had up for quite some time that got a lot of eyeballs on it, raised a lot of awareness about the issue. And that was during a time when we were even more connected than we are now. I think all of us, no matter what age you are, feeling the effects of social isolation. And so that kind of brings us to the topic today. And we've got a really great panel of folks that can talk to this subject, have really good backgrounds in devising resources and solutions. And before I hand things over to my friend Britt Bassani from the Seniors Council to give an overview of the topic, I'd like to go around really quickly and have the panelists introduce themselves. So I'm going to start with Clay and let him just say just a couple words about himself.
So I know a lot of people, and it's great to see all my friends on here and friends and associates. So I'm Clay Kemp. I'm executive director of the Seniors Council, which is a nonprofit offering senior services in 4 local counties. Probably most significantly, we're the area agency on aging of Santa Cruz and San Benito counties. And in that role, we're charged with making sure certain programs happen, things like Meals on Wheels, legal services, etc. And we're also charged with advocating and being the voice for seniors in our region. So if anything is affecting them socially, policy-wise, however, we're, one of our responsibilities is to be their voice. Oh, and the other thing, I want to thank the Warriors and Kaiser for this event. I'm really excited that we're working together. I hope today goes well. And I think all of us are anticipating this will be the first of similar events coming, and we're talking about those already.
Yeah, thanks, Clay. Kathy, you want to go next?
Hi, my name is Kathy Kress, and I'm on the Seniors Council Board, and I'm also the author of the Handbook of Geriatric Care Management. I've taught geriatric care management for 40 years, and I consult with a number of companies, including Lifespan, which is the local geriatric care management agency. And I'm really glad to be here. I really like working with everyone here, and like Joe said, it's something whose time has come. And there are answers here right now to a horrible dilemma for loneliness, which has been horribly exacerbated by COVID.
Yeah, thank you, Kathy. Well put. And Dr. Ballin.
Good morning, everyone. My name is Yaner Ballin. I'm an emergency room psychiatrist by training, and I've worked in the Bronx, New York for many, many years, as well as in California. And currently, I'm the Vice President for Behavioral Health and the Specialty Services on the Hospital Health Plan at Kaiser Permanente. And basically, the reason why I'm honored to be part of this work is the years of community level work, the engagement, and the existential issues that I've been dealing with as an emergency room psychiatrist, and now from an administrative perspective, really has shown what we're able to do with families, patients, and the communities. And now with this twist, this additional sort of stressor of the pandemic, the wildfires, and being able to then come with agencies and organizations to say, how do we put our minds together? How do we make sure that we're addressing these issues? And so I'm excited to be here. Thank you to the Seniors Council. Thank you for the Warriors, and thank you for having me this morning.
Great. Thank you. And the one thing that I always forget to do when I'm moderating things like this is actually introduce myself. So I know most of you on the call, but my name is Joe Foster. I'm the Public Affairs Manager for Kaiser Permanente here in Santa Cruz County. And as Dr. Ballin said, we're very proud to be co-hosting this session this morning. So just to give you a quick overview of what we're going to cover, we're going to start off with an overview of the issue, and Britt has so kindly volunteered to do that. And then from there, we'll go into the panel and allow Clay, Dr. Ballin, and Kathy to talk about impact of the issue, engagement, and resources and solutions down the road. And then from there, we'll take audience questions. But if you have something that's on your mind and you think, oh gosh, if I wait till the end, I may, the timing may not be right. If you want to just jump in, you're welcome to do so during the panel. And then after that, Britt will come back and share some other local resources that we've pulled together to share with you today. And then at the end, my colleague Rick Barr from Kaiser Permanente will help us wrap up. So without further ado, I'm going to hand it over to Britt.
Unmute there. Thank you, Joe. I appreciate it. I'm going to try to share screen here with everybody, which is always a little perilous, but let's see whether we can manage this. And there we go. So, yeah, my name is Britt. I'm with Seniors Council, and I've been tasked today with providing just an overview of the issue of loneliness and isolation, and some of the impacts that it has on not only individuals, but then also our community as people withdraw and become less a part of the communities in which they live, which is, it's a loss for them individually, but it's certainly a loss for the community in terms of the benefit that they can provide connectively with their friends and neighbors and colleagues if they're still working and that sort of thing. So I wanted to just, again, let's see here, I'm also admitting people as they're coming on. I wanted to, rather than reading all of these slides, I just did want to do a little bit of a high level overview of these, especially for the folks that are joining us via telephone and who aren't using a video stream. So the slide I have up here now just talks about the issue of isolation and loneliness. I think all of us understand leads to a lot of different health complications. And the University of Chicago did one study that noted that the blood pressure and stress levels are significantly higher in individuals who are lonely or isolated, and especially older adults who are lonely and isolated. Another sort of point is that unhealthy habits increase when you're lonely or isolated. The tendency, and I think probably a lot of us can sort of admit to this during the COVID crisis and all, when you're at home a lot, you tend to indulge in things that maybe you shouldn't. The refrigerator is close at hand, and maybe the liquor cabinet is, and the whole bit. And so there are a lot of unhealthy habits associated with being alone and not having that connectivity with community at all. Loneliness increases the risk of Alzheimer's disease. So on a cognitive level, there's also an impact on a person's cognition and ability to function in those areas as well. And the Rush Institute for Healthy Aging is a study that's cited in the slide that I have here as well. Alzheimer's disease nearly doubled in lonely adults, and mental decline was a lot faster in individuals who were isolated and alone. The second slide regarding the issues I have up here, there are 2 bullet points here. The first one is that isolation leads to higher instances of elder abuse. And I think we've sort of anecdotally heard a lot about that in the news, especially as the restrictions around the pandemic and social distancing and that kind of thing have sort of taken root. We've heard a lot more stories about individuals who are either self-neglecting or who are being neglected, abused even in some cases, because those kinds of pressures are magnified in a situation where you're alone and home with somebody all day long. And anybody who's, and I am one of these, who has had a small child at home all day long will know it sort of pulls you in all kinds of different directions, and not always in patient ones. So something to be very much aware of. And then the last point that I had on here was that loneliness, and lonely older adults assume the worst. And this was an interesting study by the National Council on Aging that talked about socially isolated older adults, 60% more likely to sort of have a negative view or a less than optimistic view of their future over the next 10 years. And they're also more concerned about needing help from a community that they're not engaged with anymore. So I think it also contributes stress and worry to the already sometimes difficult proposition of aging with some degree of grace. So those are all issues that I think are really important. I just wanted to point out, as I pass this back to Joe, that I think, you know, the citations here in just these couple of slides sort of indicate that regardless of your perspective, be it psychiatry, you know, mental physical health, whether you're a person working with individuals in the community, there can be a negative impact on you know, your area of expertise, your area of concern relative to the health and well-being of older adults. And so as much as we can break down those barriers and encourage people to get out and participate, I think it's not only good, again, for that individual, but also for the communities in which they live. So, Joe, that's about all I got. Do you want to pass that back to you? Or I'll take down the screen share, okay?
Great. Thank you. Thank you so much, Brett. Really appreciate you giving us kind of grounding us in the issue and talking through some of those salient points. And I think it's a really good segue into our panel discussion. And the way that we've set it up is that each one of the panelists is going to talk briefly, and then the three of them will kind of, you know, go back and forth and discuss the issues that they're bringing forth. And then, as I mentioned, we'll go into Q&A. But if you have a burning question you need to ask, please feel free to raise your hand or chime in, or even put it in the chat, and I'll keep an eye on that. So we're going to start off with Dr. Ballin and let him kind of take it from me and start running with the discussion of the issue at hand here.
Thank you, Joe, and thank you, Britt, for the intro and the overview. And you know, while so much of this can be viewed as problematic, morbid, and difficult discussions, really the lens that I want to focus, and this is sort of a personal philosophy of mine within my family and the folks that I work with and take care of, is really looking at the hope and the reality of what can be done. And it's settings such as this, and everybody that's joined that has that ability, that energy, that desire to go forward. And you know, without a doubt, 2020 has been an unprecedented year of multi-dimensional trauma, right? So trauma on top of trauma. And the outbreak itself and subsequent, the social effects, the isolation effects that Britt was talking about, the stuff that we know about, the stuff that we're living, really has already demonstrated that it's going to have a long-lasting impact on folks of all ages, right? From the youngsters and their school issues, and also specifically, and the topic of today is specifically looking at older adults, their physical issues, as well as their mental health and wellness issues, as Britt raised. And we're all doing our best to maintain distance, right? Just coming in today, I had to wear a mask and check the temperature and stay 6 feet. And we're doing our best to do this, right? To be able to then have things as much as possible done remotely, ordering things online or not going to places if it's not essential. And you know, this social isolation has caused loneliness. And these combined with, you know, the stressors of the virus itself, nobody wants obviously to get ill or get sick, and also the wildfires, right, affecting our state in California, and also specifically Santa Cruz, where the wildfires and the factors related to displacement of families and the communities themselves are compounding the risk factors that Britt outlined. And you know, so, as a physician, and you know, not only looking at, you know, the mind, but the ability to understand how it sort of combines with how we interact with other people externally and how we interact sort of with ourselves. And Britt mentioned some of the sort of the coping mechanisms, right? They're unhealthy, right? Things like abuse and this outward violence, but also violence and destruction turned inwards, right? Be it with unhealthy choices such as substance use, alcohol use, but also how that affects on a short and medium and even longer term range of the health effects. And so some things including blood pressure, right? Very simple. Our heart disease itself, obesity, right? As mentioned earlier, comfort food is real, right? Comfort food is exactly that, and it's wonderful, and everybody likes, or most people like, ice cream and potato chips, and there is value to that. But it's sort of when we're outside of our levels of our day-to-day routine and activity, and be it physical or other sort of activities, that then can compound back on one another and affect all the different issues. Things like diminished immune functioning, right? When you are stressed and you've got that loneliness and you've got those issues, the decrease of the immunity, and the reality also that there is this virus, that we want our best health and our best foot forward, so to speak, to be able to combat any of these issues is sort of another piece. And all of these things, like I said at the outset, these things are sad. These things can cause one to feel nervous or anxious, right? And then creating sort of enhancing depressive disorders, anxiety disorders, very real. And I also liked how, and thank you, Britt, for mentioning the cognitive function concerns too, where the less sort of, we're using in our day-to-day lives, interacting with folks and doing what we used to, those routines. Now, all of a sudden, we can see a decline in cognitive function. The loneliness can go into things and increase the risk of things like Alzheimer's disease and other dementias, and altogether sort of the health outcomes. And so, we're excited this morning to, have this discussion, to be able to show and promote awareness, right? The social connection itself within our communities, but also mobilize the resources that are necessary. Because to be able to address this, we have to understand what's going on. We have to identify it, right? Put a label on it and say, this is what it is. Okay, right? Diagnosis guides the treatment, right? So what is it? How do we take care of it? How do we sort of go upstream and help potentially prevent these kind of issues as well? And as Britt mentioned earlier, when you look at the United States, this is pre-COVID, and it's unfortunately gotten more intense now. But when you look at, in the United States, the population, 1/4 of older adults, right? So 25% of older adults are considered to be socially isolated, and around half of them report feeling lonely. And we've got geriatricians and experts that do this day to day, and they're going to talk about this, in greater detail. But, this has increased with these measures that I described earlier for social isolation. And Santa Cruz specifically, while I visited and enjoy very much Santa Cruz and our family there, and we've got friends there, I think the reality is that it's not densely populated. It's not urban and everyone is closely, but geographically it's spread apart. Even in the best of times, it's harder from what I understand and what I'm seeing from different health systems and the communities to access that geographically. And now with these issues described that are compounding that, it makes it even more concerning. And also, like I said, the fires, right? These are affecting all of us in terms of how we understand and negotiate our world, but also for families that have been displaced, right? Without homes right now that they can return to. And as I mentioned, the key to this is identifying it first. And the reality is there's no one single system that says, we're responsible for all of this, that monitors this and identifies it and does this, that I know of, right? There isn't one. But together with organizations that are on this call today, and those of you participating, and thank you for doing that, we're able to provide, really, when you think about it, fairly simple solutions, right? So this isn't a daunting, a solution to the problem itself, where we're able to then say, what is available to us? How do we mobilize resources? And getting specific to Kaiser Permanente, right? The place that I work and the experience that I have in healthcare systems and Kaiser Permanente specifically, we're uniquely situated, right? We've got an integrated care model, right? What does this mean? This allows for members and their families to get care where they are. Right? We were able to turn, Kaiser Permanente was able to turn on a dime, right? When the pandemic first began in the spring of this year, because we've had integrated system, we've had electronic medical records, and we had this foundation of telehealth, right? You can talk to somebody on the phone, you can do video, you can go in person, and that continues to be the case. When there was the height of it, where there was the requirement of the social distancing and the comparative isolation and quarantining, Kaiser Permanente was able to meet the demand, unlike other health systems. And that's something that I'm distinctly proud of. And as a physician and as a caregiver for many, many, many years, I also understand the value of choice, right? So that you can then say, Well, I want to, for whatever reason, be able to come in person. I want to, for whatever reason, pick up the phone or do a video visit like this. And coupled with your care provider, you can make the decision that's going to be best for you and your family. And that continues to this day. And so that being uniquely positioned with the internal infrastructure that I described a little bit, but also the investment that's being done locally, especially in Santa Cruz, for mental health and wellness, for the physical structures as well, proves to the community that not only are we invested in this and see this as a long-term resource for folks, but that also allows for people to say, okay, this is where I am right now, physically and mentally, right, and geographically, and how can I access and get the care that I want, especially with the work that we're doing within the communities. And you know, as part of that community itself, right, and we're just one of the organizations in the community, and I'm going to wrap it up in a moment. You know, we understand the importance of meeting the member where they're at, right? We have got the expanded locations, we've got the different offerings for mental health and wellness, and you know, working with the Seniors Council and with the Santa Cruz, with the Warriors, you know, to be able to ensure accessibility. Right? We're committed to having the care where it's needed for the individual, for physical health, as well as mental health. And I'm going to turn it over back to you and just say thank you for everyone listening and taking the time out this morning, and hope you're having a good time so far. So thank you.
Yeah, thank you, Dr. Ballin. Appreciate those remarks and those thoughts on the topic, and kind of, you know, setting the stage at a big level, at a 30,000-foot level, and then bringing it down locally. Kathy, your initial thoughts and comments, and you know, just, you know, share with us some of the things that are top of mind for you related to the topic and Santa Cruz County specifically.
Well, I agree with Dr. Ballin. I'm the same. I come from a point of view of hope here. And the reason being is that I have been working with the idea of finding resources for loneliness and isolation for a long time. I design programs in geriatric programs, and I teach them. And I have been part of developing and teaching something called quality of life, which I'll go over a little bit, which is a very easy but little known kind of resource that families, if your families out there, adult children especially who need this, can use in a very simple way. So right now, just as everyone has said, you know, we are social distanced, and, you know, most of our elders are sheltering in place because, as everyone has said, they're the most vulnerable. So most of the time, adult children are most worried about the physical health. And, you know, they should be. That's, you know, a critical part of this because they're aging, they're declining. But at the same time, there is quality of life, and that's what I'm going to talk about, because that's really, and this is something that Santa Cruz really knows, because we're really, I would say, cool community ahead. We're like California, ahead of probably most curves. And we believe, I think, as a county, in holistic quality of life. And holistic quality of life, I'm not going to go into a long spiel here. You can tell I'm from the East. But originally, I'm, you know, he's from the Bronx, I'm from Atlantic City. So you hear me. So what happens is that, you know, adult children are so worried about that they really do not see that they can do something as well. And that's, again, holistic quality of life. And what the heck is quality of life? What am I talking about? Well, quality of life is really joy. And what happens to older people, especially actually younger people, even kids now, when we're all sheltering in place, is we become depressed, and we certainly are isolated already, and we're lonely. But especially for older people, this is incredibly hard because they're already isolated. They've been isolated for a long time. I just read a book called Cast by Isabel Wilkerson that I'd highly recommend. And she comes up with a whole theory that, you know, the untouchables are really, in our society, from children down to older people, are older people. because they are left literally untouched, but they're the expendables. And so what we really need to do as families is to not only worry about the health, but worry about what's going to happen to their joy, to their emotions. And quality of life is about 4 things, really easy. So, and you know them yourself, this is intuition. So the first is emotional with an older person, and that's connection to family. You know, we all love our grandchildren. I adore my grandchildren. I have 10 of them. I just wrote 10 Halloween cards. And that's what we need. You know, we need connection to family. And so, and you know that you're all in a pod, so you can, you know, the grandchildren might not be able to go up because they're super spreaders, but you know, you can engage virtually your grandchildren with the older person. That's easy. We all have Zoom. And, you know, engage with friends, engage with groups that they were in, like Osher, you know, and I'm sure Clay at the end, or, you know, well, at the end, we'll talk about resources. Osher, another program in the community through UCSC, has virtual programs all over the place right now. And so do all the seniors centers in the community. So you can do it emotionally. And the other thing you have, and you know, you never think about this, and I would suggest one of the ways to find out, you know, what is the best thing for your the older person that you're around, do reminiscence. Stories always bring things out. So you want to, you know, just talk to them about, you know, you know, what did you love to do? You know, nobody asked this. What did you love to do when you were younger that you think you can't do now? Well, there's a lot of things they can do. Like Clay loves to bird watch, and you're gonna, you know, he won't talk about that. But bird watching has become this giant thing in social isolation. You can put a bird feeder. My dad lived with me for 20 years, so I actually have done the whole thing besides being a geriatric care management. He loved it because birds came to the feeder. You can re-engage at any level of care if you just ask, what did you love to do? And then physical, you know, so physical, what, you know, again, what did you love to do? You probably know that. Well, maybe they went to a gym, maybe they ran, but, you know, what you could do is weights. There's tons of things. There's, you know, there's chair yoga on television. There's a lot of ways that you can find that people can so physically engage. And it's really basically going back to that idea of at their level of care now, because, you know, I honestly can't run, but, you know, I could watch runners. I was never a runner. I'm just making that up. But, and so then there's intellectual. So again, a lot of people, you know, I would say that there's a lot of people in Santa Cruz, it's a very bright town, that read a lot. Well, the library just opened again. You can't go in it, but you can virtually get books. You can get Audible. You can, you know, there's a zillion, I mean, everybody's rebranded on television. And, you know, Netflix, the guy lives here, they've taken over Hollywood. So there's tons of things on television that you can, that are really rich and very resourceful. You know, were they history buffs? You know, did they love cooking shows? Whatever it is, find out where their joy was. And I'll give you an example of this. And this was before COVID, because so many older people I had an agency over in San Jose, and we had a woman who came in with a wheelchair who, you know, basically was the client. And that's what she, you know, and so we did a quality of life assessment, and she found out she loved being in a choir. She had a beautiful voice, but she couldn't do it because of the wheelchair. So all we did was find a choir that would take her in a wheelchair. That was when she could go out. But now what you would do is get choir music, and you have to understand that you just twist it around to what's happening. And then spiritual, and that's really important. We're going into all the holiday seasons. So, you know, just find out if they're, you know, if they belong to a religion, then how you can connect them with, you know, streaming services, religious music. I mean, you can't go to church now, or you can't go to synagogue, but you can stream them, watch it on television, and tune in. They can't quite do that, but you could do it for them. And spirituality is not just physical religion. Environment can be a religion.
Yeah.
So birds can be a religion. And so, you know, we had a client many, many years ago over in San Jose, and the man was dying. And he had been the head of the builder from Los Gatos up 17 to the reservoir. And those people had 300 of them had worked together to do that. And he had no family. So we did a quality of life. We were working with hospice and found out that because of no family, these people were his family. And this always makes me cry. 300 volunteers came when we took him home to stay with him with shifts for, you know, almost 3 weeks until he died, to just sit with him, talk about it. And that's, you know, that's because they were a part of his spirituality. So all of those things are really important, and that's where my hope comes from.
Yeah.
Lifespan, a program that I work with, I recently designed a program for them, and they have one going, but most of you can do it yourself. If you're adult children, you know, just stuck with, oh my God, I'm stuck in the house and they're stuck in the house. And like, you know, Britt said, you don't want elder abuse to happen, and you certainly don't want more loneliness.
Yeah. Thank you. Thank you, Kathy. Great. I wrote a lot of notes down while you were talking. The 4 things, the different outlets, avenues, you know, ways to find engagement, seek out engagement during this time. Appreciate those thoughts. I think we've kept Clay at bay as long as we can. We'll turn things over to Clay, and I know you know, Clay's also going to talk a little bit about, you know, why right now, why is this such a, you know, I talked a little bit about at the beginning about the MA exhibit and the awareness in Santa Cruz County that was raised by that. And I know Clay's going to talk a little bit more about that in his comments.
I'm sorry, could I interject a comment real quickly, Joe? It's something that really spins back to Kathy, and I don't want it to go away.
Absolutely.
Thank you, folks, for allowing me to interrupt for just a moment. Kathy, when you're speaking about the emotional aspect of quality of life, what was resonating with me, we kept talking about family and grandkids and children, which absolutely are important to those that have them. But I think it's important that we as a community, people don't forget those that may not have the quote unquote family that we speak of constantly. You know, the families of choice become more important, specifically those that identify as LGBTQ, who are even more at risk for social isolation prior to the pandemic, and even more so now. So I think as community service providers, we always need to keep that in mind when we're talking about isolation. At least that's my belief, that some may not have grandkids, some may not have children. They may be displaced from their families of choice or their biological families. So please just keep that at the top of your foresight, if you don't mind. I'm a huge advocate for that population, and often get underserved and overlooked. Thank you for letting me pitch my 2 cents.
No, Stephen, thank you. And anybody else, you know, like I said before, you know, feel free to jump in and interrupt me. I will not take offense to it at all, and actually encourage it. So I'm going to, now we'll head over to Clay and let Clay take the mic and take control here.
So thank you, Stephen, for that comment. It's a really important one. And I want to kind of give a global view of how we got to this meeting today and what can be done. And at the same time, take it ultimately back to things like what Lois just posted in the chat, some local projects which really help people get engaged. And, you know, she posted in there Senior Center Without Limits in Santa Cruz County, which is a project of community bridges in City of Santa Cruz Parks and Recs and City of Watsonville Parks and Recs primarily. So, you know, that's one way we can all connect. But looking at this globally, I think Dr. Balin and Kathy both laid out that this is solvable. And I think that's encouraging. And so many things we face seem overwhelming. But, you know, we can do this with simple solutions and also with increased partnerships. I love Dr. Balin giving some examples about how local partnerships can go a long way towards making things happen. And for us, you know, we've really tried to be the instigator of that. And you know, loneliness and isolation has been an issue for older adults, really for the entire society, not just older adults, but especially older adults for quite a while. So we first raised this issue broadly at a solution summit we did about 3 years ago, and had a specific work group talking about loneliness and isolation and what can we do, or a breakout group, what we can do going forward. And that meeting had about 100 policymakers and service providers at it. We really wanted people that could make a difference and take action. It wasn't so much a coming together of identifying the problems. You know, we do needs assessments to determine that. We know what the problems are. It's figuring out the solutions to moving forward. So out of that summit came a work group that decided to tackle this issue with stops and starts. You know, sometimes we got very frustrated. Sometimes we got really excited. Joe mentioned what the Museum of Art and History did, putting together a entire exhibit around this topic, and that was one of the results of having that solution summit. So it's just kind of great to see this group coming together to tackle it. And you know, all this stuff that we're describing was pre-COVID. So when COVID happened, it made everything just exponentially worse. And incidentally, you know, I mentioned that we do a needs assessment, and in our needs assessment, the response to people who are self-identifying as lonely or isolated or sometimes depressed was higher than the national average in Santa Cruz and San Benito County. So that, you know, was another reason why, you know, we feel the time is now to address this. Another piece that I think is going to play into its success is Governor Newsom is putting together a master plan for aging on the state level. And that group started pre-COVID and kind of continued through the pandemic. So it's just interesting to see those leaders evolve in their view of challenges. And COVID just increased the attention on isolation, you know, exponentially. So we really have an opportunity, and, you know, we know how horrible COVID-19 is, but it has created a great opportunity around this issue of senior engagement and loneliness and isolation. So all of us here are trying to take advantage of that and trying to do something meaningful to move it forward. One thing that our little work group was advocating for was looking at what's done in other areas, including the United Kingdom, which has a national minister of loneliness and isolation, somebody whose task is to look, you know, throughout the UK at how to address this big issue. So our small group thought that was a good idea, and we started sharing that idea, you know, throughout the state. And it got a huge amount of traction at various levels, including Master Plan for Aging. And one of the recommendations in Master Plan for Aging, and one of the recommendations for my state association, of course, from us, is that California create this position. And I'm just thrilled that California Department of Aging is actually currently recruiting for somebody to address loneliness and isolation among seniors. That position is being created. And part of that person's task will be to bridge the digital divide, which we've talked about quite a bit. You know, that's an easy way to connect, but it assumes three things. You know, it assumes that the individual knows how to use the internet, that they have a notebook or a computer or some way to connect within their house in order to connect that way. And then third, that they have internet connectivity where they live. And for a small county, you know, just over the hill from Silicon Valley, it's amazing how poor our internet connectivity is. And there's a few reasons for it. If you just look at the geography of Santa Cruz County, you know, we have lots of peaks, we have mountains and lots of valleys, and it's really easy to be in a place that doesn't have access to a tower. And part of why, you know, you see me here in the dark, I feel like I'm a guy in the witness protection program. You know, you can't really see their face, you hear them talking, but part of that is my internet challenge. You know, at my house, I have really good lighting, and that's where I typically connect. But the only way I can connect in my house is through a satellite, because I'm in one of those narrow valleys. So that is out right now, and because it's a satellite, it's not a typical repair thing, so it's going to take me 3 weeks to get a technician in. And I bring that up just to kind of highlight the challenge that we have around internet connectivity and how important that is in terms of solving the bigger solution of, you know, how do we stay connected and what do we do about it? I'm actually, you know, I'm a poster child for it. And Aptos isn't great either, but which is where my office is. So I see we got a poll popping up here, so that's nice. And I love this. We're asking how often do you feel lonely or isolated? So folks should, you know, if you can answer this, we'll have an immediate quick response to it. So love that. So anyway, you know, I'm kind of talking about the larger opportunities that we have on the state level to address, you know, these issues of loneliness and isolation, but also the challenge of it. You know, it's simple. I think one thing that we fall victim to too often is thinking that all the solutions are going to be through internet connectivity, that if people can just get online, that things are solved. But you know, Dr. Balin and Kathy were both excellent about talking about other ways to do this in person or even with a phone call. And that's one of the challenges that all of us have, and that our work group is trying to come up with solutions to. You know, how do we address the people that don't have that internet connection? How do we engage them in traditional modes if they're never going to connect to the internet? And one of the best solutions, Tara's on here and she'll vouch for what I'm about to say. It's part of why the situation is worse right now. But one of the best solutions for loneliness and isolation is volunteerism. And, you know, we all know how great it feels to help somebody else. You know, that's why a lot of us are in the profession we're in. So you can do that as a professional, but you can also do that as a volunteer. And we see that with some of our volunteer programs, the impact it has on the volunteers, not just the people they help, but on the volunteers themselves is just tremendous. So Volunteer Center is an incredible resource we have in our community. And you know, not only do all the volunteers have a huge impact, I don't want to lose the point of how volunteerism is a great way to stay engaged. Now that's a challenge right now because it's more dangerous and difficult for especially older adults to volunteer during a pandemic. But you know, there are other ways to stay engaged, and you know, I really want to encourage that. I think Britt was going to fill in some of the details. I've taken most of the time on that, you know, but I think you know, this approach that we have is what I want to encourage and engage everybody to stay with. You know, we could come up with a list of what things are out there directly to connect to. There's better places to do that, I think, than this workshop. But, you know, we can certainly do that too. So I think that covers my points. I had a list here of, you know, the key things are access. I know the last thing I want to say, you know, we think a lot about access to information and how you get it and what the training is. But as Kathy was saying, that it's not just access to information isn't how you stop from being lonely or being engaged. It's doing things you like. It's incorporating the hobby aspect to that engagement. You know, we all get overwhelmed with information. I mean, how many of us get depressed if we watch too much news right now? You know, so we need a balance between that information and doing what's fun. You know, somebody mentioned watching cooking shows. I want to watch eating shows because I mean that's that's kind of the part that I like a lot. But just that importance of having life balance, where you don't want to be so informed that you're just depressed all the time. You want to be having fun as part of that engagement.
Yeah, well put, Clay. So, yeah, thanks, you know, for our panelists providing those initial thoughts. And, you know, it's funny, when we were planning this thing out, Clay, Dr. Balin, and Kathy told me that an hour would go really quickly. And I thought, well, you know, an hour, that's a lot of time to talk. And here we are at 10:45, and we're just really scratching the surface on this topic. As Britt mentioned earlier, we do plan to do more of these in the future, and this is the first foray into that. So we appreciate you all being here today and starting this off with us. With that, I know that folks here on the Zoom meeting probably have questions or comments. I know that my good friend Ashley Van Octen from the Santa Cruz Warriors has some questions that were submitted from folks that weren't able to join us today in the event that folks on the call don't have anything they want to chime in with right away. So I'm going to turn things over to Ashley and let her guide the Q&A section and take us through the next 10 minutes or so.
Perfect. Thanks, Joe. Hi, everybody. I'm a part of the Santa Cruz Warriors. So I'm the manager of partnership activation, and I get to work really closely with Joe with Kaiser Permanente. And we're really excited that you guys asked us to be a part of this today. Just some quick background for you guys. So we have a CDUBS Classics program. That's our senior initiative in the community. So once a month, the last Monday of every single month, we send out a video, whether that's a virtual tour, so you feel like you're in the community and people are getting out and about, or it's a workout class or chair yoga. So this really tied us in with the senior council. And we also sent this to our corporate partners and season ticket holders, and we will be sending the recording of this to them too. So a big thing, just some key points for them to take away. I know we kind of touched on this, but can someone talk about the importance of awareness about social isolation in the community? Because a big thing, I don't think it's top of mind for a lot of people, but it's something that's super important. So I just kind of wanted to hear from someone the importance of it and why we should be so aware of it.
I would just say, I'm not a doctor, but I mean, literally, the importance of it is that if you don't understand that, the emotional will go to physical. And, social isolation, I mean, Kaiser had a statistic there, is worse than smoking a pack of cigarettes a day. And that kind of sums it all up, that, literally it has real physical consequences. And so that's why it's so important to be aware of it and to find solutions.
This is Yaner. I think another way to sort of add on to that would be to, once you're able to recognize it's occurring, and think back to the spring where it was like, oh, shelter in place for a couple weeks, just a couple weeks more, now it's 8 months. I don't know, now we're in the 10th month of the year, and where the reality is, how do we restructure the compassion we have for ourselves, the compassion we have and understanding that we have for others around us, so that when we can say, you know what, my knee kind of hurts, I'll walk a little slower. Okay, I'm feeling a little lonely and a little sad. What do? Do I walk slower like you would physically if you have a knee sort of issue? Or do you take things sort of a little bit sort of slower and try to figure out, what do I need to do to address it, right? You walk too fast, you can make your knee worse. If I try to push myself and I'm feeling sad or anxious or isolated, that can make things worse as well. And so I think the proper ability to then say, this is a thing. And just like, when you're dental flossing, or, theoretically, when I promise myself I will dental floss every day and I do my best, you just sort of every day, you get into sort of a new routine, a new habit to say, what am I doing to address my social isolation? I mean, most people don't talk like that. It sounds like a robot, but what am I doing to sort of connect today? One Halloween card today, I'll do the next one tomorrow, things like this. And you can be playful. And so I like that question, and it sort of, it invites us to be more aware. Right. And so you can put off the knee problem so much, right? And but the reality is, like, how much can you put off your sadness and your anxiety? And there are some things that just don't get better on its own, right? And so that's sort of where there's that two parts to it, where you can be playful and creative, but also to be able to say, what, maybe I should see somebody about this, be it your friend or somebody in your community, religious or otherwise. And so, thank you, Ashley. That's a really sort of thought-provoking question. Thank you.
Mm-hmm.
Yeah, I would add to it.
Could I add one more thing to that? I would just like to add to that I think culturally we are so unlikely to say that we're feeling lonely. I mean, that's like you're a failure. You're a social failure if you say that, if you admit to being lonely. So I think we need to figure out some way to just be normalizing it, to be saying, you feel lonely. There's something, as you said, Yenner, there's something to do about it. If you feel lonely, don't just sit and feel lonely. Think about what you could do and help people understand that they that there is actually something that they can do about it.
And right now is a great opportunity to do that. You know, the pandemic in some ways makes it okay. And I think loneliness and isolation is part of the pandemic and its own pandemic unto itself. You know, so we need to acknowledge that. And as Yenner was saying, you know, self-awareness and asking yourself the question is a big part of it. So I would just add, you know, that it's closely related to the pandemic. It's almost its own pandemic. It's actually, you know, contagious. If the people you're friends with and associated with are feeling lonely and isolated, it does spread to them. And then maybe most importantly of all, it's curable. And, you know, we don't need anything magical to happen to create the cure. We have it available and need to tackle it.
What I want to say is that right now, we are facing the hardest trial of all for all of this, because it's getting colder. So physically we're going to be in the house. We all know that's much more dangerous. The holidays are coming up, and, you know, and there's this urge. We are social animals. We want to go to Thanksgiving. We want to go to, you know, the Hanukkah dinner. We want to, you know, we want to do all that stuff. And so that really takes beyond the awareness of the older person. It takes the social animal way of doing things, which is the family, or as Stephen was saying, the support group, because we have so many pseudo families in Santa Cruz, not only, you know, the LGBT community, but also we're all like transports. You can see Yellen and I, you know, we're from somewhere else. We left our family back there. And so we have these artificial families. The family has to work together now to really keep people not only safe from getting physically safe, but to be aware of loneliness and explore other ways that you can do these holidays. And, you know, this may be going on, as we all know, for a much longer time than we think. And there's a lot of COVID overwhelm right now. There's another word for it, I can't think of it, but I mean, you know, just like everybody's sick of it and doing, you know, things they shouldn't do. So I would say that this is a really challenging time we're going in, because the, you know, the numbers are going up, the holidays are going up, and and we're inside. It's very dangerous.
Thanks, Kathy, and thanks everyone else too. And if anyone has any questions or comments, please just shout them out or put them in the chat. But I also had a question that I was asked from one of our corporate partners, and I think it's something that is really good and it could be a lot of good knowledge. How can we personally help seniors in the community? And I know that can be hard right now because we can't really go anywhere to visit people or go sit and talk with them, but what are some resources or things we can do while we're still essentially quarantined, work from home, sitting at home, that we can be of assistance?
I think that goes back to exactly what I presented, that, you know, there are real simple fixes, and it's basically just asking. And, you know, adult children don't ask this. What did you love to do? And, you know, you can, you know, the side effect is you get ancestry. You find out all those questions when you're young you never would have asked, and you maybe write them down. But, you know, ask and then, you know, institute it at their level of care, just like I explained. You can't bird watch, but go get a feeder. You can't, you know, you can't go to like a Hanukkah service. You can't have the dinner, but figure out how to do it virtually. You all eat the same thing. You know, like we've got it with birthday parties now. We all know that you can't blow out the candles, so it's got to be one thing and you blow it out. Figure out the ritual in a safe way. And, you know, this comes from family and friends, but you've got to do it in your pod.
I'd like to offer an opportunity for individuals that, again, folks that are living in skilled nursing facility or long-term care facilities are becoming even more increasingly isolated. And there was a recent report, I can't remember who did it, about the decline of those long-term care residents not having connection with the outside world and dying at a higher rate and faster rate than ever before in our history, which is very concerning. I believe it's IU Venture, which is an agency here locally, you know, sending greeting cards to folks that are in those facilities, you know, that may not have family, or because we know that their families can't visit, or they have to see them through outside of a window. You know, there's no connection there. But a simple act of kindness by sending a card just randomly to the local facilities here, and there are many of them, could brighten up one of their long-term care residents' day and add just a little bit more joy to their otherwise maybe joyless existence. So that would be something I would task everyone to consider doing. Engage your family, your children, especially during the holidays, to get that done. You know, it doesn't take but a stamp, and even then you can just maybe hand deliver it to the facility, who can quarantine it if that's what their policy is, and then distribute them safely. So that's my thoughts on long-term care folks.
And you know what? We've all been doing that through, you know, have you been writing letters, you know, because the election? I have. Postcards, just move it over. Because we already know we can be in a group and write a bunch of letters supporting whatever candidate, and I would say the candidate, but you must know who I support. So what you want to do is just, you know, you can do this. It's doable. It's easy. There's hope here.
Thanks, Kathy and Stephen. And then I was just going to say, with the writing letters, as a Santa Cruz Warriors staff, kind of what we did, because we all weren't together to deliver letters, we actually wrote letters. And then Alyssa, who's joining me, is on our CR team. And we actually sent her a picture of the letter, and she was able to go deliver them together. So there's so many ways around that. Even if you can't go deliver them, you can be at your home. A lot of us were across the country, but we could still take a picture, send it to Alyssa. She could print it out. So you can do anything virtually, essentially. But I know we have just a few minutes left, but there was one question that I did receive from someone in the Warriors organization. And I think it's really important. I think you guys can kind of hit home with it. If I am a senior and I'm at home, or I am feeling isolated, what can I do? What's a step I can take if, like, there's a stigma around it? I'm a little nervous and embarrassed to reach out. Is there just a number I can call, a phone number I should go to, or a specific, you know, one-stop shop that I can go to reach out to someone?
There's a couple that I would suggest. First of all, just senior services in general. If you're an older adult or the child of an older adult that needs some sort of social service to help them, and, you know, it could be anything from engagement or food delivery or getting a ride. The go-to number in Santa Cruz County is 462-1433. And that's Senior Network Services. And they're the triage agency. They're the information and assistance agency for Santa Cruz County. So call them. They're the experts in what's available out there. Unfortunately, they're also the experts in what's not available. So I could never be an INA worker because there's so many questions that there isn't an answer to. So, you know, so I would start there, and I would also look to the volunteer center with the engagement programs they're running right now, especially around the issue, the topic we're talking about, you know, specifically right now. If it's about how to be engaged, call Tara, and Tara can give the number. I think she put it in the chat, but you might want to say it again. And also, I don't know if you can see this, but this is in my office. It's like a warrior.
We love it.
So I thought for this conversation, I should hold it up and put it on.
I love it. It really ties us all in together.
Yeah, thanks, Clay. I'll just say I did put the link to the Stay Connected program in the chat for people. The phone number is in that link. Yeah, volunteering, if I can just spend 1 minute, of course, since I'm from the Volunteer Center, I'm going to suggest volunteering. The Volunteer Center also connects all of the IU ventures. We have those projects on our website too. So you can find, you know, a whole list of specific ways to help older adults. Also for the older adult themselves to give back, to be part of Meals on Wheels or delivering groceries is huge for their self-esteem. And I realize, you know, not all older adults are going to feel safe enough to go out in the community to volunteer, but just by, you know, trying to connect people with resources, I think is really, really important. And the new Stay Connected program made possible by the Seniors Council is an approach that we've developed that's going to enable people with different connectivity levels, whether it's just a telephone, whether they want to learn Zoom and graduate to Senior Center Without Limits. Also on that platform, we have ways that they can connect through very useful resources such as fall prevention. As we know, if you're not mobile and getting out and about, your chances for having a fall in the home increase. Additionally, we've added our connection with the state of California Listos program, which is to help people prepare for emergencies. So we're doing kind of things beyond, the friendly call program that we think are really useful resources for somebody to have. So yeah, please check out the new program. And yeah, thank you to the Seniors Council. We hope this program will grow and continue beyond this next year.
Me too, and I don't want to, I want to make sure everybody sees Angie's comment in the chat about senior outreach. I'm a little bit embarrassed that I didn't mention them because that's a terrific peer counseling program that's been established for many, many years and does incredible work.
Yeah, thanks, Clay, for pointing that out. I was going to say the same thing, that thanks to the folks that have shared some resources in the group chat. And Tara, thank you for talking through things as well. Kathy has been proven right. 1 hour went by really, really fast. And I thank each and every one of you that have stuck with us past 11 o'clock. We'll wrap up here pretty quickly. Britt, did you have any other resources you wanted to share with the group?
Yeah, I didn't want to spend a lot of time because many of them have already been mentioned, but I did want to share the results of the poll, which I'm doing right now. And as you can see there, and I think this is a pretty well-adjusted group for the most part, there's at least 5 people, and a couple of us didn't answer the poll, me included. I was busy minding the store. But at least 5 people have indicated that at least increasingly frequently or nearly always they're feel lonely or isolated. And I don't think by looking at the faces on the meeting group here today that I can identify anybody who looks that way or who looks like they need that sort of help. So I would just encourage, as Lois had mentioned and Kathy as well, to ask the extra question of people if you're concerned.
Yeah, thank you, Brett.
I'm going to screen share and stop sharing these results, and let me do a quick screen share of the last resources. So the Friendship Line and the National Alliance on Mental Health or Mental Illness, NAMI, both have suicide and crisis lines that I think we all need to be aware of, and I wanted to make sure we shared today. It's not always as fuzzy as getting out and doing some more volunteering. There are some serious crises that people are facing during this.
Yeah, I'm not able to see the screen share, Britt.
I'm sorry?
Not able to see the screen share,
Oh,
Britt.
I'm sorry, my bad. Let me do that one more time. I told you this is a work in progress. There you go. So the Friendship Line, and the number right quick for those that aren't joining us by video, 888-670-1360. And then NAMI's helpline, suicide and crisis line, 877-663-5433. A lot of people have mentioned the volunteer center. They're on this slide. Our senior council, foster grandparent, and senior companions program is on here. Great opportunities to volunteer, engage, and be a part of the community you're in. And then a second slide here is, and somebody had already mentioned this too, I believe it was Lois, the parks recreation. You've got community bridges programs, Senior Center Without Limits, and then also COVIA runs a program called Well Connected, which is activity programs and interest programs for older adults. Really easy to just dial in, participate, lurk if you want to just see if it's something you're interested in. And we hadn't mentioned at this point a local resource that I think is insanely valuable, and that's Gray Bears, which is a great opportunity for, again, a number of the panelists and others participants have mentioned. Is a great opportunity to participate, with your cohort, give back to the community, and provide some valuable services to those who are in need. So I would encourage the volunteerism, and not only, again, for yourself individually, but also to benefit the community of which you're a part. If you don't engage that way, then really everybody loses. So thank you for the opportunity to talk with you all.
Great. Thank you, Brett. We appreciate it. And I know we're up against it. Thank you all for staying with us past 11 o'clock. I'm going to turn things over to Rick Barr, my colleague here at Kaiser Permanente, to close us out. And, before Rick starts, I will say one takeaway I have gleaned from this is that we will need more time in the future to have even more discussion. That an hour, while it seems like would be enough, is really not enough to really dig into things and allow for a really robust conversation amongst the larger group. So we'll take that information back, and when we do this next month, you'll see some learnings that we've implemented into the future programs. So without further ado, I'll allow Rick to close things up here.
All right, thank you, Joe. And given the time constraints, I thought the program was just excellent. I want to thank you all for attending this first Santa Cruz County Search virtual event on isolation, and especially I want to thank our panelists, Dr. Untitled Chapter, Clay Kemp, and Kathy Kress for their expertise and the content they provided, as well as moderator Joe Foster, Britt Bissoni of the Seniors Council, and Ashley Van Octon of the Santa Cruz Warriors. As a reminder, this program was recorded and will be distributed through the representative organizations. Also note that the Santa Cruz Warriors C-Duck Classics post a new video, as Ashley had pointed out, on the last Monday of every month, which is a community program designed for all of us 55 and older. And then as a final note, information on Kaiser Permanente's Medicare Advantage plan for those that are interested is available through kp.org/Medicare or by calling 877-852-5081. Thank you all again, and have a great day.
Thanks, everybody. See you next month. More to come on that.
More to come.
Bye, everybody. Thank you.
Bye.
Thank you.
Thanks, everybody. Thanks,
Great.
Bob.
Thank you, everybody.
Have a wonderful